Welcome. Today we're discussing my concerns with a single dose of doxycycline for tick bite. I had a patient who took a single 200 milligram dose of doxycycline within 24 hours of removing an engorged tick, thinking it would prevent Lyme disease. Unfortunately, 7 months later, he was chronically ill with Lyme disease. He never developed a rash, and his lab tests for Lyme disease were negative. He eventually resolved his chronic illness with doxycycline, followed by a combination of atovaquone and azithromycin. Ticks can harbor multiple infections, not just Lyme disease. In the Northeast, common co-infections include Ehrlichia, anaplasmosis, Babesia, and Bartonella. These can lead to acute and chronic illnesses such as Lyme arthritis, Lyme carditis, chronic neurologic Lyme, postural orthostatic tachycardic syndrome, also called POTS, and pediatric acute onset neuropsychiatric syndrome, also called PANS. Effective prevention following a tick bite remains a challenge. One study found that a 10-day antibiotic course failed to prevent Lyme disease. Another study suggested that a single 200 milligram dose of doxycycline could be effective if taken within 72 hours of a deer tick bite in an endemic area. However, a single dose of doxycycline has not been shown to prevent common Lyme disease manifestations like Lyme arthritis, Lyme carditis, Lyme meningitis, POTS, or PANS. It also doesn't prevent co-infections such as Babesia. A single dose of doxycycline raises several concerns. It may prevent the erythema migrans rash, which is crucial for early diagnosis and treatment. It might also prevent a positive test needed to confirm Lyme disease early in the infection. I discuss with my patients the risk of prophylactically treating with a single dose of doxycycline versus not treating at all. I've seen patients return with acute and chronic neurologic symptoms after a single dose of doxycycline. I generally follow two approaches. Some patients are monitored closely without treatment and followed up after a month to check for any signs of Lyme disease or co-infections. Blood tests can be helpful in these cases. Other patients are treated for 3 to 4 weeks with a follow-up to assess the outcome. Patients and their families unfamiliar with Lyme disease are more likely to opt for monitoring. Those with prior experience with Lyme disease often agree to antibiotic treatment with follow-up. We need a preventive measure that effectively prevents both acute and chronic manifestations of Lyme disease and its co-infections. Although we're not there yet, understanding these challenges helps us move closer to the effective solutions. Thank you for watching, and stay tuned for more insights on Lyme disease.